Good afternoon, everybody, and welcome to Dartmouth-Hitchcock Health's Healthcare Policy Grand Rounds, which is part of our We Care, We Vote initiative, which is a nonpartisan voter education initiative aimed at making sure that, hold on one sec. Okay. Aimed at making sure that all our employees are the most fully informed voters they can possibly be on election day. And part of that means having candidates for federal and statewide office come to Dartmouth-Hitchcock Health and talk about not just healthcare policy, but all sorts of issues. Today, we're very pleased to welcome back to Dartmouth-Hitchcock Steve Negron. Steve is a resident of Nashua, New Hampshire. He is a retired United States Air Force officer, spent a career in the United States Air Force, after which he became a defense contractor working at large firms like GTE and Lockheed Martin, following which he founded his own defense contracting firm, Negron LLC. Steve, your opponent in the 2nd Congressional District race, Annie Custer, visited our institution last week and participated in Health Policy Grand Rounds, and we're very pleased to have you here today. I'm going to hand it over to you for some opening remarks, and then we'll open it up for questions and answers. And to everybody who's viewing, you can submit your questions through the chat function on your computer, and we'll make sure that that we get the question to Steve. And Steve, I know we started a few minutes late today, and we're happy to stay on for a few minutes beyond our scheduled time of 12:30, so that you have sufficient time to get your message across. So with that, let me turn it over to you, Steve. Welcome back.
Well, thank you, John, and Courtney. Hi, and everybody that's out there that I can't see yet. It's a pleasure and an honor to be back here to talk to you. I'm not originally from New Hampshire. My dad was in the military, and as John said, I was military as well. So I came to New Hampshire back in 1989. I fell in love with this state. It is the place where I met my wife, and we had our 3 children and raised our 3 kids. And, you know, Governor Sununu famously says that people born in New Hampshire are lucky, but the people who move here are smart. And so I'm one of the smart ones. To John's point, yes, I'm a retired military officer. My father was in the military, the Air Force, for 33 years, and we had the opportunity to live both here in the States and many states and abroad. I lived in Europe for 7 years growing up from when I was 10 to 17. So I have a perspective about how other countries are, and especially how this great country is. I'm really excited, you know, for those who don't remember, I did run in 2018 as the Republican candidate. We came up a bit short, but we always thought that this was going to be, that was the first half of 2 halves of a game. And so we're in the second half now. We're really excited about it. This is a state that gives me great pride to be able to have the opportunity to represent in Congress. You know, one of the things that we found out during the last 6 to 9 months, that campaigning was uniquely different this time. We weren't able to get out early like in April, like we normally do, and start door knocking and start doing our ground campaign. So we had to adjust a little bit. And what we did was we got on the phones earlier than we normally would. And then we actually went throughout the district and put up huge 4x8 signs, probably 80 of them throughout the district, because it is about name recognition. And so where we're at right now, you know, we're within 6 days of an election, November 3rd. And I encourage everybody, regardless of political leaning, to go and exercise that right. I've lived in countries that people don't have that right. And so it's one of the amazing things about our country. So look, there's a lot of information out there. I would just urge you to find out where you're at personally. Look at those issues. If there are people out there that you want to ask questions of, both locally, because I think politics is very important locally as well. I'm hoping to take some of the questions here on this thing and then looking to go forward. So really excited to be here, John, and looking forward to answering some questions.
You bet. So I'm just going to lead it off with a couple of questions, Steve, before we open it up to the larger audience. First of all, let me say thank you very much for your service and for defending our right to vote, and for defending the citizens' obligation, frankly, to vote. Our country doesn't ask much of us, but voting is one of those things. And
Yes,
I
sir.
appreciate what you've done to preserve that.
Yep.
Steve, I know you're from Nashua. You raised your family in Nashua. I know you're very
Yes.
deeply involved in the community and your church in Nashua. And Nashua and Manchester are sort of hotspots in New Hampshire, have been hotspots in New Hampshire. And as we see now, the number of cases rising. And, you know, I think about 140 cases were announced in New Hampshire yesterday. Steve, if you're elected to Congress, how would you advocate for reducing the spread of the virus?
Sure. Well, certainly you need to look at what the science is telling us. And when you have to look at those things, as we get smarter, as we continue down this path, we're a lot smarter today than we were back in January and February. And so for me personally, I know that there is a universe of folks that we need to protect, i.e. the elderly. And so we need to understand, we need to put that framework in place to protect them. But as we go down the road and we realize, you know, how really contagious this thing is, the thing you have to balance that, John, is that, you know, what are the implications of actually contracting COVID? You know, we have some people that are asymptomatic, they may have it. And so how do we get to that point where we can identify that early so that those individuals can take the right precautions, so that even though they as an individual are not feeling some of the harsher results or possibilities from COVID, but they may pass it on to people. We need to just be educated about what those things are, so that we don't take that virus and pass it on to people. So, you know what, I see some things, you know, right now in Nashville, we have a mask mandate in the city, but yet we were using a mask mandate, but yet people still contracting the virus. So we have to look at root cause, what's happening out there, and let's figure out a way that we protect those people that are most vulnerable, but somehow get to a place that we can get back to some sort of normalcy, but all the while trying to make sure that we keep this virus in check.
Thanks, Steve. So let me just follow up on one of those vulnerable populations you talk about, and that's the elderly. And as you know, many of Dartmouth-Hitchcock's patients depend on Medicare as the source of their health insurance. And the CBO, the Congressional Budget Office, recently released its 2020 findings and suggests that the trust fund will be insolvent by 2024. So if you're elected to Congress, Steve, what would you do to preserve Medicare for elderly populations as their source of health insurance?
Absolutely. And so, you know, one of the things, I was on another talk show, and so one of the things somebody asked me was, over the last 2 cycles, what's the one thing that you think that you've had not a change of opinion, but more of a more focused investigation on? And it is Medicaid and Medicare, right? You know, I'm getting to that point that I started getting, you know, AARP mailers a while back. And so I knew that I was now part of that unique group. So we have to make sure we find a way to maintain that. You know, it's not going to be an easy proposition. You know, when you look at things that, you know, my grandmother used to say, you know, you have so many gazintas and so many gazadas. And if you have less people putting in and more people taking out, you know, there's a situation there that you're going to have this upside down equation. So we need to look at some things that we can do that's more fiscally responsible, all the while balancing, maintaining what those individuals use as their primary source. We can't go around, and I can tell you one, as a father of 3 and a husband, you know, and I lost my parents within the last 5 years, you know, that we got to make sure that we take care of that population. You know, I think it's a debt owed to them. You know, they've been a productive member of this society. And so some of the saber rattling that I hear, John, you know, that we're going to take that stuff away. I, for one, am not a proponent of that, but we have to look at some things and look at the equation that's out there differently so that we can maintain it, still provide the offering that we have today, but we have to fundamentally look at how do we keep that going forward, and maybe we need to change the equation. I don't know what that answer is, but I do know that we have to start that discussion.
Thanks, Steve. I see that we have some questions coming in from the wider audience. So Courtney?
Yes, Mr. Negron, thank you so much for being with us. You mentioned that Nashua has a mask mandate. What is your stance on mask mandates, either at the state level, the federal level, or local levels? And specifically, how do you think that mask mandates relate to slowing down the spread of COVID-19?
Sure, that's a loaded question, Courtney, but I'll take it. I'm not one that likes downward directed mandates. you know, when I go into my town of Nashua, if I, as an individual, want to go into a restaurant, a place of business, and that place of business or restaurant is requiring me to wear a mask, and I want to participate of that, then I will. Absolutely. That's their call. It's their. Now, one of the things that I think that happens is that we think when we make a situation where we have a mandate, it's going to take care of the situation that's out there. And I just alluded to, we had a mask mandate, and our mayor, Mayor Donches, tested positive for COVID. So I have to ask myself, you know, is the mask doing the things that it's supposed to? Are they the right masks? You know, I don't know. I'm not in that profession, but I don't like the idea of a mandated mask. I think we have individual responsibilities, and for me personally, if I'm going to go into a situation that there are those, as I said earlier, that universe of people that are susceptible, then I'm going to respect them and wear a mask as I would to try to protect anybody else.
Courtney, how about another one?
Thank you so much. Yes, we have one additional question from the audience. If elected, what are your specific healthcare priorities?
Well, number one, there's two words I like to use, and that's accessible and affordable. And I know that there's a lot of folks out there that want to label some things. I can just tell you that I, as not only as a husband and a father and a small business owner that has to look at the right healthcare to provide to my employees, we have to be able to work in concert and bring the cost of healthcare down. I believe that we have the best healthcare in the world, in this country, but we have to make it affordable. I think we have to look at some things like in our state of New Hampshire, you know, how many insurance providers do we have? I think it's only 2.5. I think that's the number of providers in the state. I think we have to reduce the barriers to entry. Me as a consumer, I can go to different places to get car insurance or homeowners insurance or boat insurance. I should be able to work with the state and bring down barriers so that other people can give me as a consumer what I need for my family. So I need to look at bringing down costs. I think we have to absolutely reduce the cost of prescription drugs. I think we have to be able to renegotiate Medicaid Part D. I think we have to look at big pharmaceuticals that, in my opinion, sometimes have a stranglehold on some formularies that are out there, and that we only have one choice to go to. We saw that in the past couple of years about the provider of the EpiPen. You know, so we need to look at some things that makes cost affordable for everybody across the board, and that's young men and women coming into the workforce, as well as some of our senior citizens. So I'm going to work with whoever is that I can lash onto and work on those things to help bring accessibility and affordability of healthcare down.
John, if it's okay, we have an additional question from the audience, a follow-up question. You mentioned not wanting to take coverage away from individuals. Does that extend to the Affordable Care Act?
Absolutely. You know, and I got to tell you, I don't like politicizing things. You know, the Affordable Care Act is just being able to provide health care. I'm not a big fan of the government managing that. But however, what we did find with the ACA is that we did put some things in there that actually cover people with pre-existing conditions. And that's something that has to keep, whatever we end up doing, that has to be there as a benchmark. You know, we cannot just kick people out because of a physical condition that they have that existed. And I think that we have to hold people accountable that won't allow people on their plans because of a pre-existing condition. So I'm a proponent, clearly, of making sure that we have coverage for pre-existing conditions.
Thanks, Steve. I'll interject one here, Steve. As you know, Dartmouth-Hitchcock and our hospitals in New Hampshire, you know, in Manchester and Nashua, have been on the front lines of battling the pandemic since it arrived on our doorstep in March. And it has really adversely impacted our fiscal health and the way we deliver care. If you're elected to Congress, what will you do on Capitol Hill to help ensure our fiscal sustainability, our fiscal recovery, and a steady supply chain for hospitals across the country?
You know, that's a great question. One of the things that I really found out when I talked to actually people that are in the dirt mixing it up. I mean, we can sit back as pundits and think about and talk about very altruistically at 30,000 feet, but we need to talk to you guys. We need to talk to the people that are actually living, breathing, and trying to execute this thing. Look, I know that some of these things that people weren't allowed to go to your facilities to get the treatment that they needed. and it caused a physical constraint on hospitals too. You guys were kind of like overlooked, I think. You know, when everybody talks about the patient and how do we make sure we take care of them, but what is the mechanism by which those patients get taken care of? I'm not a big believer in spending, especially with the debt that we're facing, but the service and the capability that you and yourself and others across this country face, we need to make sure that you guys continue to be there, because until we know when we get to the end state with this pandemic, you guys have to absolutely be there. I would look at continuing on these relief bills. It's not something that's going to happen in perpetuity forever, but until we get to the downside and the backslide of this thing, we need to make sure that you providers are out there to make sure that we're able to keep you guys whole, to keep on doing the things that we need to do to help allow you to then treat the people that are sick. So, you know, I wasn't a big fan of the big stimulus bill because I think there were some things in there, in my opinion, that weren't directly COVID related. To me, it would be a very simple litmus test. If the money's going to an individual, a company, an institution that's providing direct care to COVID people, absolutely answer that sounding yes. I think we need to look at some other way of getting to address that situation, but I absolutely would fight to make sure that hospitals and those and folks like yourselves make sure they get the money to continue to do the great work that you're doing.
Courtney, I think I see another one.
Yes, we have another question from the audience. What steps will you take to ensure New Hampshire has a robust workforce? And we are experiencing an aging workforce here in New Hampshire. What steps will you take to attract and retain young professionals?
That's a phenomenal question. And that was one of the questions that I was asked on the WMUR debate. What was the biggest issue facing the state? It is about keeping young people here and a younger workforce here. It's a multi-pronged problem. One of the things you have to do in the world of like manufacturing is that our electrical costs in the state are through the roof. I think we're the second or third highest in the country. We need to find a way to bring down the cost of utilities so that I can keep manufacturing jobs here. I can keep plants here. We need to do some things that attracts people. Look, I came here in 1989 as a young guy, I'll tell you that. And I fell in love because everything the state had to offer. You know, the state has to offer so many things, but we have to have an opportunity and produce an environment that draws people. And I'm not talking about necessarily bedroom communities that people live here and go work someplace else. I'm talking about people that come here, live here, spend here. And I think when you look at from a manufacturing perspective, I think we need to find a way to reduce costs. I think we need to find a way to reduce housing costs and property and property insurance, tax insurance. You know, those things we have to look at. I would work directly. Having been a former state legislator, I know some of those things, and Governor Sununu is trying to work those things, and anything I can do from a federal perspective to try to help really draw New Hampshire out as a place to come and live, I absolutely would do that. But I think that's one of the keys to our future is making sure that young men and women have an opportunity to come here, to do what I did, start a family, start a business. And to me, it's been a great opportunity, and we need to make sure that they're available going forward.
Steve, I want to harken back to an issue you alluded to, and that was pharmaceutical costs and the high cost of drugs. As you are aware, Dartmouth-Hitchcock, Mary Hitchcock Memorial Hospital participates in the 340B drug discount program. And pharmaceutical companies are attacking that program and attacking the discounts and eliminating unilaterally the discounts that we receive on outpatient drugs that we purchase. And we're very reliant on those discounts in order to provide programming and subsidize services for which we are either underpaid or not paid at all or unreimbursed. So right. How would you go about protecting the 340B drug discount program against these attacks by Big Pharma?
Well, absolutely. Well, first of all, we have to look at, you know, what is a service that your institution is providing. And it is providing a care that normally would not have been unless it's the 340B program. But yet you've got a larger entity that's precluding you from doing that. I'd go to the root cause. I'd go to the source. I'd figure out, you know, look, I'm a free market guy, and I believe that, you know, companies have a right to develop a product and make a nominal profit, a good profit, right? But not at the expense that it hurts other entities that are dependent upon them. So, you know, I don't know all those things, but these are the kind of things, this kind of a Zoom meeting where, you know, I would come back to the state and we'd have a meeting with you guys and say, okay, John, tell me what are the things that's a burr in your saddle? Help me get smart. And then I have ammunition to go down to Washington, find out where that root cause is. And then you and I would be in contact, say, you know, help me understand what the problem set is so I can go fight on your behalf. You know, because a lot of times we hear one side and we're down in DC, if that's what we're doing. I think the work of a congressperson is here in the state. It's about finding out what those issues are. It's about sitting across the table or across the laptop, you know, helping me get smart so I can take that fight down in Washington. So if there's a situation right now that you say, Steve, I need your help, you know, this is what Big Pharma is doing to me. That's my job, because I work for you, is to go down to Washington, take that fight to them and figure out a way how to make things equitable for you and for the other companies as well.
Thanks, Steve. Courtney, I think we have another one.
We do have another question, Mr. Negron. If elected, what will you introduce as your first bill in Congress? And how would you break through the partisan divide that we're currently seeing in Washington, D.C.?
Absolutely. Well, let me answer the second one first. You know, my whole life in the military, and even when I was a state legislator, it's a great story that I tell. I was a freshman legislator and I didn't vote for the governor's budget. And I was one of 66 Republicans that didn't vote for Governor Sununu's budget. So I got called into the carpet. I got called into the speaker's office. They labeled us political terrorists. It was really kind of funny. And the speaker looked at me and goes, you know, that's your governor. And I said, I understand. And he goes, you voted against him. And I said, with all due respect, Mr. Speaker, I don't work for you and I don't work for the governor. I work for the people of Nashville Ward 5, District 32, who voted me in. That's who I'm responsible to. And so going to Washington, I'm responsible to the people of New Hampshire. You know, we can do some things that may have to break ranks with the party, because and to do that. I've done before. I'll continue to do it again. And I think once you're able to do those kind of things, to work across the aisle, then everybody benefits from it. Look, I'm a product of Ronald Reagan. I can remember Ronald Reagan and Tip O'Neill standing shoulder to shoulder in the Rose Garden. They couldn't have been on further opposite spectrums of the political views, but they worked together. And that's just the way I've been my entire career in the military and in private industry. So I'll certainly do that as well going down. What would be my first piece of legislation? Everybody knows about Amber Alerts, and that's a federal program that's out there. I would institute something called the Green Alert. And the Green Alert has to help veterans that sometimes that they go out and they leave, and we need to be able to find out where they are. I believe it's a piece of legislation that would resonate. I think it's bipartisan. I think it's something that we would say, okay, if I can't find a vet because he or she are dealing with some PTS issue and now they're out on their own, we have the infrastructure that's out there. I think it's something that would resonate with all 50 states. I think it's something that'd be easily legislation that would pass. So that would be the first thing I like to do, is to try to put something out there called the Green Alert, so that we can help our veterans that are in distress across this country.
That's great. Thank you, Steve. Steve, so we're bumping up against our scheduled endpoint here, but I want to give you an opportunity to make a final pitch and some closing remarks.
Sure. Well, thank you very much. Well, thank you for your time. I know it's in the middle of the day. I hope they give you some extra time for lunch. But look, this is an important election that's coming up here, regardless of where you're at. Exercise that right to go out and vote. I just can tell you that I believe that I would bring a different voice down to Congress. I would be your voice. I understand my role. I understand my role is to be about constituent service. And so come next Tuesday, get up bright and early, make sure you get that sticker that says I voted, because I think it's a privilege that we have in this great country. So I would just suggest and respectfully request that everybody go out and vote, regardless of your political leaning, because that's something that we as Americans have. And I think it's something that we should take seriously. So thank you very much. I would appreciate your vote on November 3rd, but regardless, go ahead and fill in that bubble wherever you're gonna do it.
Well, that's a great message, Steve. Thank you very much. I want to thank all of our Dartmouth-Hitchcock Health community who participated today, and I want to thank Steve Negron, candidate for the 2nd Congressional District of New Hampshire. Good luck on Tuesday, Steve.
Thank you very much. God bless you all.
Thank you very much.